Zufall Health's journey began in 1990 when our namesakes, Dr. Robert and Mrs. Catherine Zufall, formed a small volunteer clinic in Dover, New Jersey. We've since become an award-winning, multi-site community health center providing access to high-quality, affordable, and culturally responsive health care. For many of the 45,000 patients we see annually, barriers like transportation, language, low income, and lack of insurance restrict access to healthcare. One of the most important vehicles, literally, for facilitating access is our mobile medical van.
Lo que es la camioneta de Sulfo, ¿verdad? Estamos muy agradecidos nosotros como trabajadores del campo porque ellos vienen al lugar. Nos prestan el servicio, miramos si estamos enfermos, ellos nos preguntan, necesitan una consulta y nosotros venimos hacia el campo. Nosotros no vamos ya donde ellos como antes, pues hoy ellos vienen donde nosotros a buscarlos acá donde trabajamos en el campo.
It comes to our building, so I appreciate it. It's a blessing for them to come to us. A lot of people don't try to come out and help you.
Porque tienen una excelente atención hacia los niños. O sea, lo tratan como que si fuera familia. Se siente uno entre familia, pues.
The van has been a critical tool in providing care and comfort to people who are victims of natural disasters and emergencies. The van was instrumental in bringing COVID-19 testing and vaccinations to the community in a time of great anxiety and isolation. When everything else was closing down, we were still there. The van is a licensed medical facility, a doctor's office on wheels, serving hard-to-reach populations like farm workers, seniors, low-income children and families, veterans, public housing residents, and people experiencing homelessness. Almost everything that can be done in our offices can also be done on the van.
A lot of the patients or family members don't have access to a car or they're very far from the clinics.
So sometimes clinical spaces can make people anxious or weary, and that's completely understandable. Some people have different experiences with their medical journey. So bringing those resources right to the community with the van and with community events allows people to have that freedom to receive care where they want to receive care.
De hecho, a mí muy difícil, porque estos programas ayudan a las personas de bajos recursos. Yo que estoy recién llegado a este país, nunca creí que había tanto beneficio, tantas oportunidades para uno, porque en un hospital o si va uno a algo privado se requiere mucho dinero.
And by us being seniors, we're on a fixed income, so I appreciate their service.
For many patients, the comprehensive health care and outreach services provided on the van can be profoundly life-saving. Juan was unaware he was suffering from a serious, potentially fatal heart condition until it was identified by a Zufall Health provider who referred him to a hospital for emergency care.
Yo me sentí un dolor acá en el corazón, me sentía como cansado. Entonces ellos tomaron mano de mí, me hicieron examen y todo y me dijeron que era el corazón. Y entonces me salvaron la vida acá en la clínica Sulfo. Me hicieron operación de corazón abierto, pues, y hoy estoy muy alegre que vivo.
At shelters, soup kitchens, schools, farms, public housing, community events, and more, New Jersey's vulnerable and underserved communities can trust Zufall Health to bring high-quality care on the road to wherever it's needed most.